Yeah, this question is for Dr. Michelle, and it says, given your research to this point in the UK, what would you say is the primary reason for Black people's resistance or hesitancy to the vaccine in the UK?
Should I go ahead and answer that now?
Yeah, yes, please.
Yeah, please. Yeah.
Awesome. From what I've heard from talking to people, my students and other kind of organizations in which I work, I don't think the UK government did a good job in rolling out the vaccines. And I think in terms of thinking about possible side effects, I think that those early days, particularly around AstraZeneca, really put a lot of people off. And I think that just generally medical professionals have to do a better job of explaining kind of probability, right? Because one of the things about the kind of brain blood clots that were happening around AstraZeneca, they're the same amount that are likely when people take oral contraceptive. Right. And I think that there's, some difference about like whether you choose to do one versus the other. But like we all face like there's a probability that if you get in your car, it's going to result in a car crash. And so I think a lot of it has to do with the rollout and especially around kind of complications. And I think a lot of it is a wait and see. People are concerned about the rate in which the vaccine kind of came on market. A lot of people just kind of want to see what's going to happen. They don't necessarily want to be the first ones to kind of live with whatever possible side effects, if even if there are side effects about what it might be.
Okay, thank you.
Thank you.
Could I? Is it possible for me just to add on another statement for that?
Mm-hmm. Yeah, of course.
Yeah. In my experience, one of the prime reasons that I've found generally talking to people over the last 2 years, and one of the main reasons for vaccine hesitancy, it's simply to do with the fact that we don't have 5 to 6 years of safety data. Okay, with a normal, I worked in pharmaceuticals for 12 years, and one of the things about the clinical trial process is that before a drug goes to market, there has to be 5 to 6 years of safety data. Now, why do they pick 5 to 6 years? Do they just pick that because it's just the number to pick? Why is it not 1 year or 2 years? Well, it's 5 to 6 years because of the fact that that's the length of time that they say is suitable to assess if there are mid to long-term impacts of the medicine in question. We have a situation where the vaccine was developed based on 9 months worth of clinical trial data, and then it's been rolled out. So what people are saying, look, I haven't got a problem with the vaccine, and don't tell me about previous vaccines, because previous vaccines went through and had the proper 5 to 6 years worth of safety data. So we're sort of caught in a quandary where unless we develop a time machine where we can export ourselves to 2025, 2026 and look back, and maybe when we look back, we will say, well, there was nothing to really be worried about. Everything was okay. Or maybe we may say, wow, in year 2, year 4, all of a sudden there's these cases emerging that have never been. So certain people's hesitancy is because of the fact that the clinical trial development process, there were certain aspects that simply could not be duplicated. Yes, we understand that with investment, it can take 9 months. If there's a will, if there's the right investment, yes, we can duplicate, we can have things running in parallel. Absolutely agree with that. But the one thing that cannot be duplicated is time. 5 to 6 years. We will never know the full scope of the impact of the vaccine until 5 to 6 years' time. And that's why risk-based decisions have to be made in terms of the fact, well, we can't wait 5 to 6 years, we've got to do something. And so that's again where vaccine relevancy comes in. Vaccine relevancy says, okay, we know that there are people that if we just leave it, they are going to be the ones most at risk. So let's ring fence them in. But at the end of the day, does that give justification that this vaccine is then rolled out to every single 9 billion people on the planet? And I think there's arguments that it doesn't necessarily have to be like that. And also what people have said is absolutely spot on. We have to look at this as a portfolio, that the vaccine is not the silver bullet, but it's just one aspect of a number of different ways that we actually have to confront and fight and protect ourselves against the virus.
Thank you, Reverend Les. Any more questions?
May I make one quick comment?
Yeah, if it's quick, yeah, sure, of course you can.
Yeah, and to what Reverend Les was saying, and you know, we have to ask ourselves, what are we actually, what's the end goal? Is the end goal simply to make sure that we're not getting infected, or is the end goal that we have equality, quality of life? If it's quality of life, which I hope it is, then to your point, Reverend Les, then we shouldn't just worry about everybody getting vaccinated, and we don't need to have everybody vaccinated to look at how the virus works. And we can, but what we can do is to accept the ones that are vaccinated and then still work on quality of life by looking at our health. That's what I wanted to say.
Thank you, Dr. Ludmilla. Thank you.
There's another question here directed to Dr. Ludmilla. Is the tension between access to health and the access to healthcare addressed in the UK by the fact that we have the NHS?
So the NHS is your access to healthcare.
Yeah.
What I would like to take as, just like I've mentioned the Hurricane Katrina, where they said, well, you know, we're giving you access to healthcare, so you didn't have it before, so you should be happy, and we're giving you all this other stuff. But you didn't look at our health. You really didn't. If I look at what's going on in the UK, I remember when the Denise, I mentioned to you that the high rise had burned down.
Grenfell.
Okay.
Grenfell.
So you can then put the people in another house, but have you talked about their health situation? Do we know how those people are doing? Or did we just displace them to another place and then, you know, put a ribbon around it and say, here, we help the people? So it's not just the NHS, it's the other issues that we have not addressed. We immediately went to healthcare. That's the only thing we focused on, healthcare, without even we didn't even do a needs assessment of everybody who was affected by the virus. We didn't do that. We just went straight to healthcare. Everybody fits the same shoe. So we all did it wrong. United States, UK, everybody, we didn't launch it right. That's what we did.
If I can just say, in terms of the removal from the house, and that's really important. I'll say this very, very quickly. Some time ago, I was doing some teaching on attachment theory. Those of you know about John Bowlby's attachment theory with children and so forth. And I said to the class, let's just use this attachment theory. What happens to people if they are then removed from their land? Unbeknown to me, there was a woman who'd done her degree in anthropology. And she said, oh yes, can I make a comment? I said, yes. There is a common belief, the reason why the Native Americans are such a high increase of mental illness and depression, when they were removed off their land in Canada, there was the belief that they were being removed from their ancestors. So it wasn't just being on the land, but it was the relationship they had with the land and the history and the culture, and removing them caused them to experience depression. So in a way that their whole world was actually disrupted. So there's this whole thing about possession, location, and so forth. Really important in terms of our well-being, which must not be dismissed whatsoever. Yeah, thank you for that, Dr. Ludmilla.
I have another question. I guess this is a more strategic question, and invite all the panel to comment on it. Start with Marion. To the panel, do you have any suggestions as to how our hesitant community can be taken seriously by government agencies?
For me, it's actively listening to what they're asking. If you're hesitant, there's a reason why you're hesitant. So answering the question. If it means giving them information, evidence, you give them that information. Because I think that's so important that you actually listen to a person, because if it's that important and you want them to have the vaccination, you've got to inform them of the information, give it to them. They're asking a question. Don't fad them off and say, you know, you need to have it. The question is important because the question will allow that individual to be informed to make a decision based on choice and information. So it's listening to them.
Reverend Les, yeah.
Yeah, I think I totally agree with Marion. I think it comes down to, I mean, we've seen so many things that I never thought I'd see in my lifetime. I mean, we keep talking about, you know, tyrannical regimes in North Korea and China. I mean, just to give you an example, many of us probably every Thursday night would have watched a program that comes on every Thursday evening at 10:30 called Question Time. Remember, it was something that used to be hosted by David Dimbleby. And this was a great pastime for the UK because it was actually a show which really espoused some of the noble virtues that have always defined the principles that this country stands for in terms of open debate, freedom of thought, critical thinking, political debate, scientific debate, and even the involvement of the public in terms of the discourse. Mm. And I think hesitancy is also sort of influenced by the fact that people are saying, hold on a sec, why is it that all of a sudden these things, these noble virtues that have always underpinned our society have all of a sudden been pushed aside? So, you know, in the pub, we don't get public debates where you've got scientists with different viewpoints actually debating and reasoning so that people can actually have a wholesome understanding of all of the viewpoints. And I think that's probably one of the reasons why there's hesitancy, because people are saying, I just keep hearing the same thing, the same arguments, when I know that there are thousands of doctors, credible doctors, who are fighting to be heard, but because what they say doesn't go along with the government narrative, they are not getting the opportunity, and they're having to resort by going on social media, etc., etc. I also think people are also looking at other things like coercion, like, you know, people getting free lottery tickets if they take the vaccine. So it's even in America, you know, I think it was in Atlanta, there were certain prison institutions where they were inside, basically saying to inmates, certain types of inmates, that we might possibly reduce your sentences if you take the vaccine. So people are kind of looking at all of these coercion and saying, what's actually going on? You know, 2-3 years ago, any pharmaceutical company that was using coercion for people to take their medical products, that would have been frontline news. So people are seeing a lot of things and saying, hold on a sec, all of a sudden we're now starting to see things that were hallmarks of tyrannical regimes that we always said things like that could never happen in the UK, and we're starting to see it. So that obviously causes people to become more hesitant. All people want is just an open debate, knowing that there are various viewpoints, credible viewpoints that actually are based on data and science. Let's just have open debate so that people can actually have a better, wholesome understanding, rather than feeling that they're being pushed, prodded, and pummeled into a particular direction where they think that shouldn't really be the way how a free democratic society should work.